Hello guys, welcome to my new video. Today I want to discuss the very important topic. The topic name is what is a pneumonia in the newborn baby or what is a pneumonia in a child. First of all, if we define the pneumonia is a basically lungs infection which caused by a bacteria or viruses. It's mostly caused by a gram-positive bacteria which is known as a Streptococcus pneumonia. So in this infection, the baby lungs are badly affected. The pyogenic infection are caused, a pyogenic mean a pus in infection. When the pus are accumulated in the lungs, so it means that alveolar collapse and they do not gain the oxygen from the environment. When they do not gain oxygen from the environment, then the difficulty of breathing happen, because we know that the main function of a lungs is to make a oxygen, to gain a oxygen from the environment. But when the lungs are affected, then how the baby or a child gain oxygen from the environment? So it means that if the lungs are infected, it means that our respiratory rate are infected. So the baby or a child don't take a breath normally because our lungs are infected with the bacteria and the pus are accumulated in the alveolar sacs. All the alveolar sacs are filled with the pyogenic or pus. Then what we can do? How we can know that the symptoms when we know that our baby, our child having a pneumonia? The number one symptoms of a pneumonia is that respiratory rate is increased, mean that tachypnea are caused. Tachypnea is known as a when the breathing is a rapid, mean fast breathing, and tachycardia also happen. A tachycardia mean the rapid of a heart rate. It means that a respiration is increased, a heart rate increased, and the sputum are caused. A thick secretions are in mouth. It means that these secretions are disturb the respiratory airway. Then your baby don't take a breath very well. Sometimes a grunting happen, mean the abnormal sounds of cry are happen, and the other solid symptom is that the baby feel very lethargic. It means that your baby feel like a low energy, and your baby having a high grade temperature due to a severity of a bacteria. So your temperature should goes on to the 104 or 103 Fahrenheit. So if you feel or if you seen are these symptoms, it means that your baby having a pneumonia infection. So what is the solution? If we talk about the cureness, if we talk about the solution of the pneumonia, so first of all, if we have a some first aid, the first aid is that we give a nebulization, we give a sometimes a steam. In this way a nebulization melt the sputum. In this way secretions convert into the liquid form, then they are excrete easily. The other symptom is that we give a Panadol drops to reduce the fever. But if the reduced fever is not reduced and the symptoms are not below, then we should convert. Then we should consult our pediatrician. The antibiotic cover through intravenous, and all the treatment are given in an incubator or when your child is admitted under by a pediatrician or consultant. Then these treatment are given to your child or your baby. Then your baby take a normal breath for the intervals of periods. So it means that 1 weeks are required because the pneumonia incubation period are 1 weeks. So in this way your doctor give a antibiotic treatment and a nebulization cover and a steam cover and in other drops or oral suspension form. So it means that a chest X-ray is very important in the pneumonia cases because a lungs functions are seen by a chest X-ray. So I hope you like my video. Thank you so much for your response. Thank you so much for your love. Thank you so much. Stay happy, be blessed, and always take care of yourself.